Hello, I am Nurse Meg from nursemegrn.com, and this video is all about how to start an IV. You might have clicked this video because you're a new nurse or you're a nursing student and you're looking to improve your skills. I think this is fantastic. When nurses or nursing students are doing their own research outside of school, this means that you want extra help and you want to be a fantastic nurse. This is like the first sign of being an awesome nurse and a sign that you're going to really succeed on the floor or whatever job that you end up in because you're looking to improve yourself. So this video is all about how to physically and mentally prepare to insert an IV and then to actually stick the patient. So I'm going to give you some environmental tips, and all of these tips and tricks come from my article, How to Start an IV. So I have an entire blog article all about that. I'm going to put a link down below in the description, so maybe it'll help you to go along with this video and maybe to review, and maybe you'll want to print out the article and take it with you to work, because I also have some visuals and pictures that are going to go along with this information that are really going to help you. A lot of my students and new nurses that I train get very intimidated by the whole getting venous access and think it's like this whole other world and some crazy skill that they have to do 1,000 times to obtain. And I think that when you know what to expect ahead of time, you have optimal environmental conditions, you're gonna get it. It's okay. I'm gonna give you the best tips and tricks that I've learned over the last 12 years of being a nurse. You're gonna do it. Have some confidence in yourself. It's not that hard. You're making it harder and you're blocking your success mentally. So before you walk into the patient's room, the best advice that I can give you is to just gather all of your supplies. Always have extra tape on you and gauze. There's never enough in those kits. I actually have a great little holder on my stethoscope that I use, and I'm going to put a link down below. I found it on Amazon, and it's so great. It's so that I always have tape on me and I don't have it rattling around in my scrub pockets. And then always have an extra kit in your pocket. So if you keep it in your pocket and it's not an isolation room, you can always return it to the Pyxis or use it for somebody else or down the road or something. But yeah, keep one in your pocket and then have one out with extra supplies as you go in. Of course, always wash your hands, explain to the patient what you are doing and that you are temporarily placing the needle and leaving a very soft, buttery catheter into the vein. Always explain to them that the needle doesn't stay in their arm. I would say about 90% of patients don't get that. They think that you're sticking them with a needle and that the needle's just gonna stay in their vein until they don't need it anymore. Help them out. The next tip that I can give you is to turn all of the lights on. Turn on the little bathroom light, turn on the little overhead light, turn all of the lights on. The more light, the better. So you can see the contrast of the vein to the tissues regardless of their skin tone. All right, the next step is to unpack, and we're gonna get started. So put on your gloves because your safety is paramount. Safety first. Place the tourniquet above or below the elbow depending on where you wanna start. I like to start below the elbow so you can have just all this access. If you know that you want it in the hand, just put it right above the wrist to get started. But I like to put it below the elbow so you can just kind of look everywhere. There's lots of veins here. There's veins here that are really easy to get. The hand is easy, but they also don't last long. So if you're on the floor and this patient's gonna need IV antibiotics and IV access at least once a day, try not to go in the hand if you can. Also, access in the antecubital, those don't last very long and they're very uncomfortable for the patient. So if you can avoid the AC, the antecubital spot, also skip that. Definitely leave the tourniquet on for a couple of seconds, for 5 to 8 seconds, to really let the veins fill up so that you can see them. And yes, it's supposed to be tight. So as you're waiting for the veins to fill up, this is when you need to prime the extension. You should always be priming the extension set with normal saline or the flush that comes in the IV kit. Because once you get the vein and then you're trying to hold it and prime the thing, you're gonna get blood everywhere. set up as much as you can ahead of time. And that's probably one of the best pieces of advice for nursing in general. So as the vein starts to pop up, you're gonna want to look and feel around with your gloved hands. So if like you see a really good vein and you start to feel it to determine like how it feels beneath the skin. Now listen up, a vein will feel bouncy compared to like just regular tissue. It's gonna have a little bit of a bounce to it, almost like when you push into like a really inflated balloon or like a soft hose filled with water, which in this case it's a vein filled with blood. So an area that does not have a vein is just gonna feel like squishy, like skin tissue, like dull. It's not gonna have that little bounce to it. It is something that you have to feel around and practice and get a feeling for. So if you ever have like an extra tourniquet, put it on yourself and start feeling your own veins. So once you've found the vein that you want to go for, the acceptable vein, you're going to want to like open the alcohol or ChloraPrep, whatever is in the kit, and then scrub, scrub, scrub. Okay, there are so many germs on our skin, even like right after you shower. Okay, so don't be afraid to like over scrub the area. It's fine. Clean the area and then clean the surrounding area that you're going to get ready to attempt, because when you do the little cover, you're covering like, you know, a 1x1 area or sometimes a 2x2 area depending on your IV kit and the dressing. So you're gonna wanna just clean that whole area, like a 3x3 square area. Okay, and so if you are right-handed, you're holding the IV catheter in one hand, in your right hand, and then with your left hand, you're gonna pull the skin down. So this is called anchoring the vein, and this is probably the best IV tip that I can ever give anyone ever. So let's say this is the vein that we're going for. My veins are really pretty. Thanks. So let's say this is the vein we're going for, and I want to insert right here. I'm going to go below it like 2 inches, and I'm going to push down and I'm going to pull down like kind of hard. So push down on the vein and then pull it down. So that what that does is it anchors the vein to prevent rolling, and also if someone has like wrinkly skin or just loose skin, it really helps to anchor it, the skin and the vein all at once. And you're gonna get it pretty much every time when you do that, if you have like the right catheter insertion way to do it. So I have some visuals that I wanna show you right now on kind of like how to get it in there and the proper technique for insertion of a catheter. So yeah, anchoring and stretching out the skin increases your chances, and then you're gonna go ahead and now that you have scrubbed the area, you know where you wanna go, you've got it anchored, you're gonna wanna insert the catheter. So pierce the skin, don't hesitate, but don't stab the person either. You don't wanna be like, you wanna have a nice swift motion, but you also don't wanna like stab them. So it's like a swift but gentle motion, not too slow, not too fast, because if you go in too fast, the chances of blowing it are pretty high. Also, if you go too slow, the chances of blowing the vein are also pretty high, because you're just kind of like standing, like reaching on the outside. All right, so when you get it, remove the tourniquet. Once you get blood return, you could advance the needle like 1 centimeter more, and then push the plastic catheter and then retract the actual needle so that the little plastic catheter stays, and then the needle comes out, and then you can quickly screw on the extensions set, and then you remove the tourniquet. Now some plastic catheters have like a stop lock technology that gives you like 4 seconds before the blood starts like leaking out prior to putting in the extension set. But if your catheter does not have that, you're gonna use your other hand, your left hand, to like put a little bit of pressure over the insertion site, like where the catheter is in the vein. You're gonna push down there to prevent the blood from like pouring out, and then you're gonna use your other hand to grab the extension set, unscrew the cap, screw it into the actual IV catheter. I'm talking about the extension set. I said extension set, right? Okay, yeah, cool. And then once you've connected the extension set that is pre-primed, it better be pre-primed, what I like to do is I like to pull, and I always, once it's primed, you keep that saline you keep that saline syringe on there, because when you connect the extension set, what I like to do is I pull the syringe back just a little bit to check for even more blood return. So if you get blood right away, great, flush. Not like super hard, but flush. And make sure it doesn't infiltrate, make sure there's not a little bubble of normal saline under their skin, hurting them. And then if you don't get blood return right away, you might be at a valve or you might not be in the vein. So if you're at a valve, try to flush it lightly, because sometimes good IVs can be at a valve and they're good IVs. They'll last a long time, but they don't get blood return because of the position of where the valve is in the vein. So flush it a little bit. If you can flush it and there's no sign of infiltration and the patient feels no discomfort in that area, you did it, you got the IV. Congratulations. You have successfully started an IV, and then you go ahead and secure it with a dressing and give yourself a little pat on the back. FYI, the most experienced nurses can miss a vein. I have been a nurse for 12 years. I've worked in the ER, I've worked in CVICU, I've worked in step down. I have lots and lots of experience, floor experience, and I can still miss a vein. So don't get discouraged, always ask for help. We are not meant to nurse alone. That's why I'm here. That's why I make these little videos and have a little blog and blah, blah, blah. So there you go. That is my video on how to start an IV with some of my best tips and tricks. I hope that this helped you with the visuals and everything. If you want a little bit more, again, like I said earlier, there is a blog post and article outlining this and kind of step by step on how to do this. If you want, it might help you to print it out and highlight the parts and the steps. I'll put a link down below in the description to that article, and then I'll also put links to my social media. We should be friends on social media, totally, right? And if you have a video request that you want me to make a video on, if you struggle with something specifically in nursing school or being a new nurse, please tell me. I would love to make a video just for you. So thank you so much for watching. I will see you on my blog, Nurse Meg RN, and I'll see you next time. Bye.